This is part 1 in our 8-part series that explores the ins and outs of identifying the best patient intake solution for your healthcare practice. Not all patient intake solutions are created equal, which is why it's important to know about the different program features, functionalities, and shortcomings. Healthcare organizations have a reputation of being slow to adopt new technologies, even when innovations are available that could vastly improve the patient experience. It took a pandemic to be the catalyst that would accelerate the modernization of healthcare practices across the globe. Of these innovations, contactless patient intake solutions were one of the most visible and widely rushed to market. They popped up everywhere, but it's extremely important to know that most of these solutions were quick fixes created in response to the COVID-19 outbreak. But there's one solution that's been available for quite some time and had already established a proven track record of usability and reliability, and that's Yosi Health. Yosi Health was founded in 2015 with the primary goal of improving outcomes for both patients and staff by delivering the first safe, remote, easy-to-use, contactless virtual waiting room. With the focus on maximum patient engagement, we developed and brought to market the first pre-arrival digital solution as our core competency years before the pandemic. Then 2020 came and COVID-19 struck. Crowded waiting rooms, point-of-care kiosks, tablets, and old-fashioned clipboards presented a significant risk of spreading contagions. Providing a safe experience for patients throughout the care continuum became a necessity that dramatically altered the landscape. Most, if not all, practices recognized that to retain their customers, they had to quickly pivot. The goal was to move the registration process out of the waiting room. Alerted to this need, many point-of-care hardware companies accelerated their development of an integrated remote intake workflow, facilitated remotely primarily by their customer cell phones. The best-case scenario, their patients would now be able to complete the registration digitally, remotely, and safely. Some of the major point-of-care focused companies that delivered pharmaceutical marketing ads in their tablets and kiosks quickly pivoted to offer digital pre-arrival and seized on the opportunity to deliver pharmaceutical marketing ads directly to patients' cell phones as well. It's one thing to see a pharmaceutical ad on a kiosk or tablet in the waiting room, but getting a drug ad generated from a text message from a doctor on one's own cell phone is an entirely different experience. Most patients don't want pharma ads appearing during or after the registration process. Whether it be at the point of care or remote, pharma ads simply don't deliver the best patient experience. This is something that Yosi Health determined early on in the process and is why we don't disrupt the patient intake experience with intrusive advertising. There are at least 4 reasons why pre-arrival intake trumps point-of-care registration. A better patient experience. Most bad reviews heaped upon healthcare organizations have little to do with the quality of care the patient receives. The majority of complaints focus in on the patient experience leading up to the point where they receive care. When executed properly, an automated digital experience allows the patient to complete everything in the comfort and privacy of their own space when they have the focused time before they arrive. All of the paperwork is completed and there are no unpleasant surprises when they show up for their appointment. Pre-arrival registration leverages contemporary consumer behavior. People have a sacrosanct relationship with their cell phones. They are extremely comfortable and grateful to be able to register for care on a well-designed application. Time saving for both patient and practice. Because of all the paperwork and patient registration requirements that are completed prior to a patient showing up, there is significantly less time spent in the waiting room. And on average, this digital experience affords an additional 7 minutes per patient with the provider. You have one chance to make a first impression. Onboarding a patient is their first experience of any practice's continuum. For healthcare organizations, this means making your first impression, the patient intake process, and follow-up procedures as frictionless as possible. Building a platform for a piece of dedicated hardware is very different than building an application that can operate on all the mobile networks. At Yosi Health, our core competency has been providing a safe, mobile, pre-arrival solution from the start. We understand that taking advantage of the flexibility from the latest technology available, our platform is designed to quickly meet the custom needs of each individual organization. Being mobile-focused, our solution can expand the scope of our products and services as mobile technology evolves. For obtaining the best digital registration engagement platform, it's important to know if this platform was built around the remote engagement from the beginning, or if it's an ancillary solution quickly put together on a legacy platform. You need to evaluate how the solution enhances the patient experience, and will it be able to grow as your practice and the expectations of your patients grow. Find out how Yosi, the original, safe, remote, pre-arrival patient registration intake platform, can deliver better patient and staff experience, improve your outcomes, and increase the revenue for your organization.